All right. Good morning, good afternoon, good evening. From wherever you are joining us from, please can you confirm if you can hear me?
We can hear you, sir.
Can see you. We can't see you. All right. So, all right. Thank you. Good morning, good afternoon, good evening from wherever you are joining us from. My name is Rancha Nongwan, the Executive Director of Settlement House ADR Training Institute, an institution for the training and certification of ADR practitioners, ranging from mediation, arbitration, negotiation, among others. Today, it is my pleasure to introduce to you Ateyebi Rukayat, a trainee of SHATI membership. Uh, um, she is doing a sensitization on trauma-informed mediation as one of the requirements one of the requirements for a certification as a full member of the institute. Permit me to hand over the mic to her to tell us briefly about herself before she proceeds with her class. Please, Ajayebi, over to you.
Yes, sir. Thank you, sir. Good morning, good afternoon, everyone. My name is Otebu Kayatolo Abukola. I'm a legal practitioner and the training for SHATI. Apologies, I had a little network issue. So the topic I want to present today is trauma-informed mediation. I want to share my screen. I don't know. Can anyone hear me, please? Hello? So, thank you. It's my pleasure to welcome everyone to this webinar. The topic today is trauma-informed mediation, advancing ADR through healing, empathy, and restorative practice. Thank you for taking your time to join this session once again. This webinar is for lawyers, mediators, ADR professionals, students, or anybody simply interested in peaceful dispute resolution. And I hope today's discussion will broaden and perspective more on mediation and the role trauma plays in conflict. So over the next 30 to 1 hour, 30 minutes to 1 hour, we'll explore what trauma-informed mediation means, why it matters, and how adopting this approach can lead to a more meaningful and sustainable dispute resolution. So we'll start with understanding what trauma is. Understanding trauma. Understanding trauma. So when many people hear the word trauma, they immediately think that we are talking about war or physical violence. However, trauma is much more bigger than that. It is not just about violence. It's something that most of us deal with on a day-to-day basis. It could be a person can be traumatized from domestic disputes, from workplace harassment. Most female can recognize or align with that. Then divorce, child abuse, loss of employment, bereavement, accidents, sexual abuse. A lot of things can cause trauma. For instance, where there is a dispute about unpaid salaries in work, it can actually cause psychological trauma for the victim. So what I'm basically saying is that trauma changes the way people process conflict. This simply means that two people can have an experience of trauma or a life-changing experience or a life-changing experience and processes in different ways. The way we process trauma is actually different, and it is simply the way the brain detects the event or reacts to it. This simply explains why traumatized parties may interrupt frequently. So what this means that a mediator must recognize that these reactions are survival responses rather than intentional misconduct. What is trauma-informed mediation? Trauma, we'll first define what trauma is. Trauma refers to a person's emotional, psychological, or physiological response to deeply distressing and disturbing experiences that can overwhelm their ability to cope with the situation. Like I said, examples of trauma are domestic violence, workplace harassment, divorce, child abuse, and lots more. It is important that we understand that events that causes trauma for one person may likely not cause trauma for the other person. Let's take for instance the issue of rape. Oftentimes we see movies portray Black women in a strong light in a situation where they are raped. They just like cry, take care of themselves, and move on with their life. Unlike white women in movies, where they just get stuck on that issue of rape, and their life seems to be in on the old because of that single event. It's not because it's not traumatic for a Black person, but because we are on survival mode and we just think, okay, even if I tell people this happened to me, what is anybody going to do about it? And that is exactly people's view about these things. They think, oh, if I talk about it, who is going to do anything about it? I'll just be stigmatized. So they keep quiet and just go on with their life. This doesn't mean they are still not traumatized. It just means they found a coping mechanism. However, when they are put in a situation that we make the trauma show itself, they show symptoms and signs of trauma. So what I'm simply saying is we have different ways, or people have different ways of reacting to trauma, or people have different way in which they handle traumatizing situations. So as a mediator, during the mediation process, we can never know the full story of a person or of a party. It is therefore encouraging that we should always address the parties with empathy, patience, and an approach to understand their story, especially um, in fact, in all aspects of mediation, because trauma actually shows in daily life, and it can since mediation covers a range of issues such as divorce, workplace conflicts, personal life conflict, and land issues. There are several reasons why people may not want to. So, as the famous Gabor Mate famously said, he said, "Trauma is not what happens to you; it is what happens inside you as a result of what happens to you." This is to remind us that mediators should focus on not the event that occurred, but also the lasting impact that the event may have on the individuals participating in the mediation process. Types of trauma, we have acute trauma. This is a trauma that likely occurred from a single event and stuck to the party that is traumatized. So acute trauma results from a single distressing or overwhelming event that threatens a person's physical or emotional well-being. Such events may include kidnapping, armed robbery, serious road traffic accidents, sexual assault, or sudden loss of a loved one. Although the event may occur only once, its psychological effects can persist long after the physical danger has passed, leading to fear, anxiety, hypervigilance, or avoidance of situations, and remind the individual of the traumatic experience. We also have chronic trauma. Chronic trauma develops as a result of prolonged or repeated exposure. This chronic trauma could be as a result of child abuse, repeated domestic violence, or even workplace bullying. Then we have complex trauma. Complex trauma is the cumulative impact of multiple traumatic experiences, often occurring over many years and frequently within close personal relationships. Some of the examples could still be abuse, repeated abuse, neglect, violence, displacement, or other traumatic events throughout different stages of life. Because it is cumulative in nature, um, complex trauma can profoundly affect a person's emotional well-being, such as making relationships or decision making, or even the ability to trust other people, making mediation particularly challenging without trauma-informed approach. For someone that has been constantly abused, or that is dealing with complex trauma, it is very, very important that the mediator takes patience, takes the time to understand such party instead of um, not paying attention or just dealing with the mediation process like it is a normal process. Then we have historical or collective trauma. This is a shared psychological trauma. It impacts a lot of people collectively. Example of this is Nigeria's current insecurity issue, the issue of banditry, the issue of a lot of people, students, children, parents being kidnapped, beheaded. This is a trauma that we all share in. It is not an individual thing. It affects everybody. I still have friends that are traumatized by the NSAS protest in 2020. They had the gunshot, they witnessed the bloodshed, even though the government insists there was nothing of such. I still have friends that are traumatized from that event. So it doesn't have to be a particular isolated event. It could be something that happened. It could even be something that happened outside Nigeria. So far as it does not affect one person, it affects a lot of people. That is historical or collective trauma. Then we have trauma and conflict. Trauma and conflict are closely related, but they are not the same. Conflict arises from disagreements, competing interests, or perceived incompatibilities, whereas trauma influences how individuals perceive that experience or how we respond to the experience. So a person that has experienced trauma may react to conflict with heightened fear, anger, withdrawal, mistrust, or emotional distress. So a trauma-informed mediator must recognize the party's behavior in order to be able to resolve the traumatic, not even resolve the traumatic experiences, but in order to be able to empathize with the party and extend graciousness or patience or strategies that will promote the safety and the constructive dialogue in order to enable the parties to reach a conclusive dissolution of the dispute. How trauma changes conflict behavior. Trauma can significantly influence the way people think, feel, and respond to conflict. So rather than reacting calmly and rationally, a person who has experienced trauma may perceive situations as threatening and respond through instinctive survival responses, commonly known as fight, flight, freeze, or fawn. This may manifest in anger. So sometimes you see people react to a situation in a very aggressive way. We only think about what is going on at the moment, but it could actually be influenced by what they are feeling. That is something that may have happened to them and they are just reacting to because the current incident triggered their fear. So recognizing these behaviors as possible trauma responses, it enables a mediator to respond with empathy and create a safer and more supportive environment for dialogue and resolution. Why does trauma matter in mediation? Trauma matters in mediation because it can significantly influence how parties communicate, make decisions, and respond to mediation process. So where a person is angry or has mistrust or is reluctant to negotiate, it might not be because they don't want to resolve the issue. It might just be from a place of fear or pain, which is why a mediator cannot only focus on the legal or factual aspect of the dispute. You have to understand the underlying dynamics, which may ordinarily be overlooked. Otherwise, the mediation may not be successful. But for a successful mediation, a mediator has to make the parties feel respected, loved, understood, and they need to understand that where they are is a safe place where they can express themselves and let out their fear. For example, if a mediator focuses only on the legal dispute, mediation may fail, like I said. But when a safe environment is created for the parties will feel free to express themselves and properly explore the dispute resolution and negotiation processes. So, principles of trauma-informed mediation. Trauma-informed mediation is not therapy, and a mediator is not a counselor or a psychologist. The essence of trauma-informed mediation is not to change the mediation's role from mediator. It is simply to make the mediation process much more easier for the mediator and the parties themselves. Because when a mediator understands where a party is coming from or where the parties are coming from, it will help in guiding them properly in reaching a favorable dispute, amicable resolution of the dispute. So trauma-informed mediation simply means conducting the mediation process in a way that recognizes the possible effects of trauma and seeks to avoid causing further harm. A mediator must be neutral at all times and as well as being empathetic. It is important that a mediator knows what to determine, when to terminate mediation, and when to refer the appropriate parties to mental health professionals if the need arises. And this can only be done where the mediator is able to read between the lines to understand when a party is traumatized, and then the necessary step can either terminate the mediation if it seems it's going to further traumatize the or trigger the party, or they refer the party to a mental health professional if it's not something a mediator can handle. Like we said, a mediator is not a counselor or a psychologist. A mediator is just a mediator. So, trauma-informed mediation is built on 6 widely recognized principles. We have safety, trustworthiness, transparency, collaboration, empowerment, and cultural sensitivity. Safety, this simply means that a mediator should be able to make the parties feel physically and emotionally safe. For example, in a domestic violence matter, where it is apparent that one party is violent, that is why they are there in the first place. There is no reason for a mediator to push that both parties should be in the same room during the mediation processes, because that may lead to the suppression of the other party who happens to be the victim, and the person may not be able to express themselves properly. So in this situation, it is best to actually attend to the parties separately before the final settlement. Trustworthiness. A mediator has to be trustworthy. He has to be able to keep promises, because it won't make sense. It won't be good to make a promise that you can't keep to one of the parties or either of the parties, and then they find out that you didn't keep your promise. It is going to end end up making them lose trust in the mediator and in the mediation process itself, and that will not resolve the dispute that has brought them to the mediator for mediation. Then transparency. A mediator has to be transparent. He has to be able to tell the parties what they are to expect at the end of the mediation. Remember, the mediator is not deciding for the parties. A mediator is just there to guide the parties in reaching an amicable resolution of their dispute. However, a mediator still needs to explain to the parties, be transparent, let them know what the likely outcome, not likely outcome, what they are likely to expect from, what they are to expect from the mediation process. The mediation process is not automatically going to solve their problems, but it is a good step into resolving the disputes amicably without them turning to enemies at the end of the day. Then collaboration. A mediator needs to avoid controlling the process. He has to invite participation and ensure that none of the parties are shut out. They both participate in the mediation process. Then empowerment. A mediator has to give choices to the parties. You can't say, you can't say you must do this. You should rather say, would you prefer to do this? Would you prefer to do this? That is giving them the opportunity to make choices, or giving them options, letting them know they have a number of options they can take. They don't have to do that one thing. There are other ways they can approach the situation. Then cultural sensitivity. A mediator has to be culturally sensitive. You have to be sensitive about other people's culture, other people's religion, gender, disability, community norms, and without stereotyping. Understanding people's culture. We have many tribes in Nigeria, for example, not to even talk of internationally. So let's say for an example, in Nigeria, we have different cultures, and oftentimes our cultures and religious beliefs are different from each other. Muslims believe in female sitting separately while male sitting separately. In a situation where you have um multiple parties, you have to be sensitive about that. Let the female sit on one side while the male sit on the other side. Then culture. In all cultures, children are not expected to speak rudely to adults, so that has to be maintained and all that. Then people of disability, you have to ensure that they are well catered for and that their disability is not going to affect the mediation process in any way. Then this approach ensures that parties feel heard, respected, able to participate meaningfully in the mediation process. Ethical considerations in trauma-sensitive ADR practice. Ethics are the foundation of every successful mediation process, and mediators must go beyond simply facilitating discussions. They must ensure that mediation process is conducted in a manner that is safe, respectful, and free from practices that will traumatize the parties. A mediator has to make sure that whatever goes on in that mediation process does not cause further trauma for the parties. That is why we keep saying mediators are not therapists or counselors. So when they realize a party needs a therapist or a counselor, they are supposed to refer such party to the appropriate professional. A mediator also has to be neutral, which means you cannot take side in the mediation process. Even, let's say for instance, in a case where children are fighting for inheritance of their parents or of their mother, 5 siblings, same mother, but the first child does not have the same father with the 4 siblings. And then the mother left the property allegedly to the 4 siblings, but not the first child. And then they come for mediation. And when they explain what happened, you be like, you can't be like, oh, but the first child should, according to all cultures and religion, the first child is like the heir of the family. So whatever property is being inherited goes to the first child first, except for some religions, especially Islam, where we have the Islamic way of distributing property, where the male gets more property than the female. It's already there's a formula for the sharing of the inheritance. But in a situation where in some cultures, the inheritance, I think like the Igbo culture, the inheritance goes to the first male. Even if he's the last one, all the profits goes to him, which means even if the first one is a female, doesn't get any part of the property. You as a mediator cannot pick side like, what do you mean? I'm a woman, she's a woman. Why can't she get part of this property? No. You have to maintain neutrality, you have to maintain confidentiality of information being shared with you, and you have to ensure that the parties are there voluntarily. It cannot be, let's say, a divorce matter, a dispute, domestic violence issue, and then maybe the party that has been perpetrating the violence drags the victim who suddenly said, oh, I'm tired of this violence, and maybe drags the person to mediation center for mediation process. You cannot continue with that kind of mediation. You have to ensure voluntary participation of the parties, and you have to have respect for human dignity for a successful mediation process. So a trauma-informed mediator therefore balances empathy with professional boundaries. You have to remain alert to power imbalances and safety concerns, and recognizes when a matter should be paused or refer to an appropriate mental health professional. By adhering to these ethical standards, mediators create an environment where parties can participate meaningfully and work towards sustainable and mutually acceptable resolution. Some of the ethical considerations in trauma-sensitive ADR is professional boundaries. A mediator has to maintain that professional boundary. You can be curious as a mediator, but you have to maintain the boundary. You cannot diagnose you cannot diagnose a party because you are just a mediator. You can use your discernment to or read between the lines to see what is going on or to understand better, to understand the parties better. But the moment whatever is going on is outside mediation, you have to refer them to the appropriate mental health professional or appropriate body to a mediator has to make sure that, like I said earlier, the example I gave about the domestic violence parties, the mediator has to make sure that the parties are there voluntarily and they have consent, they gave consent for the mediation process to commence. A party that did not consent to a mediation process cannot be bounded by it. So the party has to be there really to ensure, and the mediator has to ensure that there is power balance. Both parties want it, not that one party decides to just coerce the other party into coming for the mediation. What not to do? A mediator must avoid forcing apologies. A mediator must not demand forgiveness. A mediator must not rush settlements. Mediator must not ask for graphic details or blame the victims. A mediator must never take over decision making or assume silence means agreement. Where safety is compromised, a mediator must not insist for joint sessions. And practical strategies for safe and effective mediation. Trauma-informed communication is a communication approach that recognizes that a person's word, emotions and behaviors may be influenced by past traumatic experiences. So rather than focus on only what the person is saying, a trauma-informed mediator must read between the lines, must try to understand what the person is not saying, how the person is communicating. Are they communicating in a particular way? Are they communicating the way they are expected to be communicating? Is there an underlying factor in that communication? You have to be able to read their countenance and all that. So the goal is to create an environment where parties are safe, respected, heard, and empowered to participate meaningfully in the mediation process. A person who has experienced trauma may perceive ordinary interactions as threatening. Raised voice, accusatory language, interruptions, or dismissive comments can trigger fear, anxiety, or emotional withdrawal. For this reason, trauma-informed communication requires mediators to use calm, respectful, and non-judgmental language while remaining patient and attentive. Like I said, a trauma-informed mediator has to be able to read between the lines in some mediation cases that so that you can understand whether the party is there of his or her own free will or out of coercion, or if they need help that is beyond that mediation process, and so that you can make the proper and necessary referral. Then some practical techniques for trauma-informed mediation. A trauma-informed mediator is expected to use open-ended questions, such as, can you help me understand what is most important to you? Instead of asking questions like, why did you do that? Can you help me understand why that's what you did is most important to you? You have to acknowledge emotions without validating or rejecting the party's position. For example, I can see that this conversation is difficult for you, rather than calm down. When a party is having difficulty expressing his or herself, and a trauma-informed mediator says, calm down, that may automatically make the party to shut down and not continue to express his or herself because he will not feel hard. But when you say, I can see that this conversation is difficult for you, you are opening yourself up for the party to see that you are willing to listen, you are ready to listen, and you understand what he or she is saying. Also, you have to avoid labels such as, oh, the party is difficult, the party is aggressive. I know this may be difficult. For instance, I have a client that tries to go to the church to talk to the church, and I keep telling her, oh, you can't keep doing this. You can't go to the church. It's it makes the other party think maybe the church is taking your side or the church is going to take your side. It gives them the wrong impression. Whereas the church is only, you are just trying to like, that's how you know how to do best. But as a lawyer, I sometimes I might feel like, oh, this woman is difficult, but telling her that will make her lose trust in me because she came to me to help to represent her, to defend her in the matter. If I tell her she's difficult or aggressive or cooperative, she's not going to believe in me. She's not going to believe I'm fighting for her cause. So same goes for a trauma informed mediator. You have to show the parties that you are approachable, that you are curious about what they have to say, not by calling them names or being aggressive towards them or acting uncooperative. So you have to speak in calm tones because, like you said, when different people have different triggers for their trauma, some is raised voices. If you speak aggressively or if your tone is too if you sound aggressive or your voice is too loud, it may trigger them and they might be reclusive and not willing to respond to the negotiation process or the resolution process. So a trauma-informed mediator has to speak in a calm tone, allow the parties sufficient time to respond, which means you have to be patient and you have to avoid interrupting them. Give them time as long as it takes for them to express themselves the way they know how. You have to use natural and respectful language that promotes dignity and self-determination. Just because they came to you to settle dispute for them does not mean you have to talk to them anyhow you like. You have to you have to you have to be calm with them. Ultimately, trauma-informed communication does not require mediators to become therapists. Like we said, they are not therapists, they are not counselors, they are not psychologists, they are just mediators. And when they see these patterns where the parties require more help, they have to refer to the appropriate um, parties, appropriate bodies that can help. But before mediation, a trauma-informed mediator has to screen the parties to ensure that um, to ask the right questions and set the right environment for the mediation process. So a trauma-informed mediator has to ask whether there is any safety concern, there is history of violence, or if either of the party fear each other, or if there are any accommodation issues. You have to know the circumstance of these parties to be able to help them. Then you have to recognize possible indicators of trauma, such as emotional signs. Is the party crying unexpectedly? Do they have panic attacks? Do they look anxious? Are they showing excessive fear? Are they are they acting like they are ashamed or they are emotionally numb or they are indifferent to whatever is going on around them? You have to check for behavioral change, the inability to make decisions. Are they agreeing to everything the other party is saying? Are they refusing eye contact? Are they hypervigilant? Are they becoming defensive? Are they constantly scanning the room, sudden anger, or even withdrawing from the discussion as if they are not part of the discussants? You have to check for physical signs. Are they shaking? Are they sweating? Difficulty breathing? These are all the things that a trauma informed mediator has to be on the lookout for. These are the things that the party will not tell them, but you as a trained trauma informed mediator has to look out for. You have to look out for trauma triggers, um, something that may trigger the trauma of either of the parties. It could be emotional or psychological, like you said. Like did they react to being interrupted, to being ignored, the way they are sitting, is there any particular word they keep repeating? For me, I don't like people telling me, okay, okay, okay. It actually, or when I'm angry, people tell me, oh, calm down, actually gets me more angry. So because well, let's see, calm down. So you have to check all these things like how are they reacting to what is going on. Like I said, a trauma informed mediator has to be able to read between the lines of what the parties are not saying so that you will know what they are saying. Then managing emotional escalation. A trauma-informed mediator has to be an active listener, need to understand, not just to respond, need to avoid being judgmental, need to be able to manage emotional escalation, need to acknowledge feelings without taking sides, pause the sessions when the feelings are running too high. You have to offer break, use caucus at the appropriate time, reflect on the party's emotion. Then as a mediator, we can adopt simple, effective trauma-informed practices. Like I said, calm down. No, don't say calm down. Say, I can see the discussion is difficult. Instead of why are you angry? Say, can you tell me what concerns you most about this? Instead of that's irrelevant, that's dismissive of the party's feeling. Say, what do you mean? Help me understand why that is important to you. This open room for you to um, understand the parties more and to be able to help them more as a trauma-informed mediator. Then we have practical case studies. This is a divorce matter where the wife refuses to speak whenever her husband raises his voice. Her silence is not merely a reaction to her husband's raised voice, it is a response to traumatic memories from childhood. We also have a practical case of commercial conflict. Two business partners are dissolving their company, and one rejects every proposal. It eventually becomes clear that he previously lost everything through fraud by another business partner, and he lacks trust. His lack of trust is shaped by the past trauma. He doesn't trust anybody to enter into business with him. Then workplace mediation. An employee burst into tears when asked about lateness. The real issue, she has a ailing father at home. So most of the time, the events that triggers might have nothing to do with the trauma, but there is something that triggers it, and that is what the trauma-informed mediator has to be on the lookout for. In conclusion, trauma-informed mediation reminds us that conflict is often about more than legal rights. Behind every dispute, a human story is there. And when a mediator combines the knowledge of trauma, when a mediator is trauma informed, you know what to look for, you know the triggers of trauma to look for in the parties. It helps to um, effectively resolve the issue brought them to mediation. And I believe that trauma-informed practice will become an essential skill for every mediator. Every mediation room contains more than legal position and settlement proposal. It contains people with histories, people with emotions, and people with life experiences that shapes or shape how they communicate, trust, make decisions. Trauma-informed mediation does not require us to become therapists. It requires mediators to become more intentional in creating a process where every participant feels safe, respected, and heard. When we do that, we don't just resolve disputes, we help restore dignity and strength and the possibility of lasting peace. Thank you. Um, is there any question? I'm sorry, I'm just saying the message that said they can no longer hear me. I'm so sorry. Yes, please, you can ask. Few minutes. Okay, so the question says, in a situation where a particular party is bent on not agreeing to the other party, what will the mediator do? So, like I said earlier, part of the duty of a mediator, a trauma-informed mediator, is to be able to understand the party. You need to first understand the situation, what situation brought them for dispute, why are they there, what are they mediating over? When you understand what that is, then why is the party refusing? Why is the party refusing to agree to the terms of mediation? However, when a situation like that arises, it means the mediation can no longer go on, means the process can no longer go on since one party is hell bent on not agreeing. However, before you conclude that the mediation is has broken down, you can um Mr. Miracle, please can you check that you are not muted from your end? Miss or Mrs. Omotayo, please
Okay. Thank,
come with.
okay, ma. Thank you so much for the wonderful presentation. Sorry, I would have sent it the question through the chat box, but it's not opening from my hand. That's why I'm raising up my hand. So please, ma, the question I want to ask is this: If like um if a mediator notices that maybe a particular client is actually traumatized, is it in place for the mediator to refer the mediator for therapy? I don't know. Is it right?
Yes, ma'am. That is exactly.
Maybe.
Sorry, go ahead, please.
Okay, ma. Okay, no, that was what I want to add. That is it right? Is it ethical to refer maybe.
I can't hear you anymore, but to answer your question, yes, it is very right. In fact, for a trauma-informed mediator, that is exactly what you should do. The moment you realize one of the parties is suffering from trauma.
Sorry, please, I didn't get your response, ma.
Okay, I said that is exactly what you should do. It is ethical, especially for a trauma
Okay.
mediator. The moment you realize one of the party is traumatized and the mediation is triggering the person, you are expected to refer them to the appropriate body. Like maybe they need a therapist, you refer them to a therapist. If they need to go to mental health hospital, you refer them there. It's for the best. That is exactly what a
Okay. Okay. Thank you very much, ma. Well done once again, ma. Thank you.
oh, ma. Thank you, ma. Mr. Miracle, can you hear me now? Please, is there any other question? Explain the question I got last to explain it better. A trauma-informed mediator is also a normal mediator, but as a trauma-informed mediator, one of the things you are looking out for in your parties is whether they are traumatized, whether they are willing there, whether they came for the mediation willingly, and when you notice any of these triggers, when you notice that they have symptoms of trauma, or when they even tell you, some will openly tell you, oh, I'm traumatized, you are expected to refer them to um, a, in the right party or the right body, the right professional body for help. It is not a problem. It is not violating any ethical laws. In fact, that is what a trauma-informed mediator is expected to do. So please, does any other person have a question? Mr. Miracle, I know you have a question and I'm sorry you can't hear me, but can you type out your question so I can
I
read it?
can hear you now.
Oh, Miss, thank you. So the question, please.
Okay, I was asking in mediation generally, and there's a situation whereby one of the parties, is bent on not agreeing with like the other party,
Oh, okay.
and yeah, I don't know what will happen. What would the mediator do in that particular situation?
Mediation is a process where two parties come for resolution of their dispute. Like I said earlier, a mediator is not a judge. You just sit with the parties to let them understand what the problem is and help them. You assist them to reach a resolution, amicable resolution. So now what you do as a mediator basically is you ask party A, oh, what happened? Why did you do this? Or no, what is the problem? Why are you here? Then when he explains, party B, is that true? Is that what happened? Tell us your own side of the event. Then party B says, then you as a mediator, you note what the problem is, then you ask them questions, open-ended questions, calmly, respectfully, in a way that they are willing to open up to you. Then they tell you, oh, this is what I want, this is what I want, this is what he or she agreed to, this is what he or she is not agreeing to, which means you cannot tell them, okay, since you said this is what happened, and you also said this is what happened, this is what we should do. No, a mediator doesn't do that. You just tell them, okay, Mr. A, what do you think we can do? If he tells you his part, you ask Mr. B, Mr. B, what do you think we can do? When he tells you his own part too, and you see that, okay, it's not aligned, okay, Mr. A, you heard what Mr. B said. What do you think? Is this something you are willing to accept? If he says no, you keep going back and forth till both of them are willing to come to a reasonable point of agreement. You understand? So in a situation where one party refuses or stays adamant and does not want to agree, you can't force them. You can't force them, but you may call them to decide one party at a time. Why don't you want to agree to this? This is what you said the problem is. Do I understand it properly? Is that what you think the problem is? Yes. Okay. So now, when you said this is the problem, the other party is willing to meet you halfway to do this. Is it that the meeting halfway is not enough? Do you want something else? What do you think we can do, or the other party can do better that will make you accept to this resolution? If the person, this is why approach is very important to the parties, and why as a mediator you have to be able to read between the lines. You know when a party is intentionally being difficult, and you know when there's just something beneath that difficulty. So you should, as a mediator, be able to make the parties open up to you. However, like I said, if a party is still, after all your efforts, is still not willing to agree to a terms of settlement, it means the mediation has broken down irrefutably, and there's nothing you can do. They have the option to go to court, or they can remediate again. In fact, they can apply for another mediation session, or they can explore litigation. So you can't force decision on any of the party. It has to be whatever they decide on has to come from the both of them. So when one party is willing to resolve the problem and the other is not willing, you can't do anything about it, sadly, as a mediator. Does that answer your question, Miss Miracle?
Yes, ma. Thank you very much, ma.
Thank you very much, ma. Please, is there any other question? Does anyone have any other question? In the absence of no other question, thank you very much for taking time to participate in this webinar. I really appreciate it, and I wish us all the best.
Sorry, ma, my hand is up, please.
Please go ahead.
Hello, ma, can I be heard, please? Okay, ma, sorry, it's not a question. I just want to ask if it's possible can you graciously share the material with us, please?
Yes, ma'am. I'll send it right away.
Okay, thank you very much, ma. Thank you. Yes, ma.
Thank you. I've sent the material. Thank you, everyone. Appreciate it.